Hello, everybody. I am so excited to share with you Dr. Britta Nevitt, who is a naturopathic doctor. I got to meet with her or watch her speak in her glory and expertise on a food marble call, which we'll talk about as far as breath testing for SIBO. But this gal right here is someone we need to know around SIBO, around gut issues. And when I looked her up, she's a fellow San Diegan right out of North County. And so I had to connect, and it's just been so fun to meet you, connect with you, and now I get to pick your brain and share it with my email subscribers, my YouTube, my clients. And so thank you so much for sharing your expertise with us today.
Thank you so much, Taylor. I'm so grateful for you and for being such a bright, shining light and a beacon of knowledge that you're sharing with the world. I think this is such an important space to raise awareness and increase access to resources for patients in need. So thank you so much for doing this.
Let's do it. So I always, we have to start with like, who is Britta? Like, tell us why you decided to get, all this training in naturopathic medicine. So just give us a little bit.
Let's do it. And also, I'll say disclaimer, I talk a lot with my hands. So if anyone's alarmed, I did have a kitchen injury I'm still recovering from. So when I wave around this crazy looking finger, that's why. But yes, to answer your question, so grew up with a lot of GI issues. IBS-D type symptoms kind of came to their peak when I was in my last few years in high school. So much so that it kept me from going out to do what a normal teenager should. I missed a lot of dinners with friends, some athletic events, some social activities, and I can just remember very vividly being like curled up in the fetal position on the carpet on the ground, like, what is wrong with me? Anyway, I went to UC Berkeley for my undergraduate degree and ended up studying nutrition. And while I was there, I was learning about, how to eat in a way that's supportive of your health. You walked everywhere, so I was walking everywhere. I took a meditation class, got into acupuncture, a lot of these modalities that really support the whole person and the mind-body connection. And my symptoms went away. And I was like, what the heck happened? I've always been really passionate about science and explaining things as much as we can with the scientific method. And so I said, all right, I'm going to dedicate my life to figuring out what happened here and how can I use this to help other people do the same. So
Woman on a mission, and that's what I got when I first met you, for sure. You're also Berkeley grad, so that tracks. That track.
we bears love a mission to help other people. So
Uh-huh. I know I have a lot of bears. I know a lot of bears. So that's so great. I also wanted to invite you if you needed to share another disclaimer because you are no longer in practice. You had a very successful practice in North County and have pivoted to a product that I'm hoping you're going to share with us today. So do you want to do that now or should we do it later?
sure, I think disclaimers up front are really helpful so that people
Okay.
know coming from and can always take everything with a grain of salt. And I will also try my best to remain objective, recognizing that as a feat that is probably fully impossible completely.
Yes.
So yes, I am a naturopathic doctor. Recently sold my telemedicine practice, so I'm no longer seeing patients as of about 6 months ago. And I know it's crazy. I also have a natural supplement company. I'm co-founder with another really good friend, previous patient, and she's a pharmacist, an integrated pharmacist, Elma Dobrik. It's called Dhara Therapeutics, and we're focused on supporting gut health and overall wellness through a microbiome first perspective.
That's why we're going to get in. I'm like, I got to talk to you. So that's what I'm curious about is like, what did you see in your practice? Like any sort of trends.
So the the greater population of patients who are diagnosed with IBS and resultantly SIBO is women.
Okay.
There's a lot of reasons that that possibly could be. And I do also want to say that doesn't mean that this is a women's disease. We
Right.
absolutely have pathophysiological reasons for this. Maybe men are seeking help less often or aren't as open about their symptoms, or maybe it's, more a propensity towards autoimmunity. There's a
Yeah.
lot of reasons that this could be, but I do see some reasons why you maybe more women would come to see you.
So what did you see? Like, what was some of the trends from your clinic?
Absolutely. So usually the people who came to see me were people who had already kind of gone through and seen a conventional gastroenterologist, maybe worked with their primary care physician or maybe another integrative practitioner, and were diagnosed with SIBO or maybe were led to, consider something like SIBO. And as I'm sure you've seen in your practice, this can be a really nuanced condition. And I like to say that I don't know a lot about anything except for this because of a very obsessive personality. So I've spent a lot of time learning just about this. So I really had the opportunity to take my neurospiciness and apply it into hopefully helping people with just this. So a lot of people who had already been through a lot of treatment rounds, highly educated on this condition often, where
Okay,
we're
yeah.
looking just for a different approach or to kind of bounce some ideas off of. There are definitely kind of some common patterns and frustrations that I saw. I would say one I touched on before, relapses.
Right.
I would say I think the data is a little bit varied based on the research you look at, but about 2/3 of patients relapse within about the first 3 to 6 months, which is tough. And I think that's why this integrative approach is great. That's really looking at these root causes so we can hopefully do everything we can to prevent that relapse.
Yeah.
Additionally, maybe two other things would be long-term low FODMAP diets. And I feel like you and I could probably like do a whole talk on low FODMAP diets.
Yeah.
So we'll decide if we want to dive into that. And then the last thing, which I think is like maybe how I've shifted my mind a lot in the last year, especially, is this idea that we used to think that you really just have to do continuous kill protocols. And it's always about killing or starving or reducing. And I have shifted my mind towards thinking about it more about balance. If we really think about SIBO, IMO, ESO as dysbiosis, how do we nourish the good guys and support a terrain and an environment to have more of a lasting balance? Anyway.
And that just totally aligns with the Integrative Cancer Conference that I was just at, the Jansky Integrative Cancer Conference, because they're looking at cancer as a terrain issue as well. Like you can't just chop off the tops of the cancer or just hit the tumor because there's cancer stem cells that just sit dormant waiting to come back if the terrain is not correctly and appropriately addressed.
I would love to pick your brain on that topic. And I feel like it's got to be true for a lot of things in health, right? A quick fix would be great, but sadly, we don't have that for pretty much anything in life.
Pretty
Anything that
much.
really is worthwhile doing.
Yeah. Okay. So I think like take us. So for because what I'm thinking is happening with some of the people that are looking and searching online for support is that they're like, let me just take that probiotic or let me make that yogurt to just handle it. And so I'm curious, define each one of those SIBO issues, if you can, for us, just to kind of get us all on the same page. And then we can go into more questions.
Perfect, perfect. And I'm assuming you're referring to the alphabet soup of the SIBO, EMO, ESO that gets thrown around a lot. Yeah, these are terms that I do think that they're important because they
Yeah.
can affect how we support these patients moving forward. So SIBO is the term that's most well known, most likely, and that stands for
Mhm.
small intestinal bacterial overgrowth. This used to kind of be the overarching umbrella for the subtypes of two other alphabet soup names, EMO and ESO. And now we're thinking that these are really kind of three different conditions with some overarching themes. So
Cool.
SIBO specifically, now we think of as hydrogen SIBO. It's overgrowth of two organisms, primarily in the small intestine, E. coli and Klebsiella. EMO, intestinal methanogen overgrowth, is a overgrowth of methane-producing archaea, and this can be in the small or the large intestine. Quick chemistry memory. We know that we need hydrogen to make methane. So there's also a hydrogen organism overgrowth that then gets fed into those archaea that make methane. And then lastly is ESO, intestinal sulfide overproduction. And this is overproduction of a gas called hydrogen sulfide. And that is produced by two unique organisms as well.
Mm.
None of these gases are inherently evil or bad. In fact, we need some
Right.
of them and some confer health benefits, but it's all about balance.
Hence what you just shared earlier. Okay. Yeah. Circling it back. Perfect. So that's so helpful. So when it comes to like you said E. coli and Klebsiella, which I thought was super fascinating from Cedars-Sinai and Dr. Pimentel's research, right? Where it's like the IBS people, 60% are actually, it's just an infection. And that just blew my mind last year. So can you speak to like what you know about those two pathogenic organisms and why like we need to look into them?
Yeah, so this is such a great question, and I think references some of the really exciting new research that's coming out all the time,
Yeah.
especially by the mass team at Cedars-Sinai, led by Mark Pimentel. And the first piece of this that you've mentioned, so we're seeing that about 60% of IBS-D patients have what's called post-infectious IBS, which essentially is they get food poisoning by one of typically four key organisms. It's Campylobacter, E. coli, Shigella, or Salmonella. And of people, not to scare people, but if you get food poisoning, especially longer duration of food poisoning from one of those organisms, about
Mhm.
1 in 7 of those patients will go on to develop IBS, and truly lifelong. It's even higher if you get Campylobacter. I think it's like 1 in 5. Yeah. And what the team and Gemelli Biotech has done is they've created is it okay to say brand names? Is that cool on this?
For me, I'm not under any governance.
Okay.
So if we need to scratch it from the record, we absolutely can.
Okay, no worries. Well, they've developed a test. There's a test that's been developed that can test for what's called anti-vinculin antibodies. So what happens is you get food poisoning with one of those organisms, and the organisms produce this toxin called CdtB toxin. And your
Okay.
body, cytolethal distending toxin, your body does what it's supposed to do, and it mounts this response against the toxin.
Mhm.
It's like invader, not good, not good, not good. What's like the cruelest thing in nature in autoimmunity is that unfortunately, a component of your gut nervous system looks super similar to that toxin. So your body accidentally attacks your own gut nervous system, which is just like so sad.
Yeah.
But this is a thing now that we can quantify and test for, and I think having a data point is incredibly validating. So
Yes.
so anyway, this test can test for that antibody that is lasting in a lot of these patients and then can predispose you to develop things like SIBO. To your point then of E. coli and Klebsiella. So what the team has now done is they've looked at the organisms that are in the small intestine. They've taken samples and
Mhm.
they've looked at characterizing what organisms are actually present in patients with SIBO. And in the case of hydrogen SIBO, about 18% of their whole microbiome is dominated by Klebsiella pneumonia, and 28% is E. coli. Whether or not it's that same E. coli as that kind of like original infection, I don't think we know. I feel like that's maybe
Okay.
far-fetched, but it could be possible.
Oh, yeah. Okay. So I think before we go into the methane, because that was my picture, that was my fun journey,
It's so tricky and hard to navigate for sure.
and fungal overgrowth.
Did you have mold too? Was it the Three Musketeers?
Well, I definitely had the mycotoxins in red, a lot of them from a total tox burden. So there had to have been some level of exposure too, from definitely from diet, obviously, but I think, yeah, could be very easily exposed.
I'm so
Yeah.
sorry.
No.
Are you good? I would love to hear more about your journey. So I'm curious what you found most useful, and maybe we need a whole
Well,
other podcast.
yeah, no, I absolutely I mean, I guess we can go into that because my next question, my next curiosity is just like like the testing is like just a big fatty question. So maybe we can go into just IMO real quick. And so just to speak to what I know, and then you can add lib onto what I found out about this is that I tested using, I've taken the breath test from like, just a regular normal breath test that we could order and did food marble. And that's the lactulose breath test. And I did any of those. So I think I've tested 7 times. And in my article, I say how big of a pain in the ass it is.
Yeah.
Breath testing is annoying.
Yes, it is, and can be expensive depending on which method you're using, and
Yeah.
yeah, and a lot of preparation and time, and sometimes heartbreak.
Yeah. So how I went about my levels was like, well, let's kill. So I was not going to do the Rifaximin just because of how my leaning is always to go natural first, and we'll talk about that in a second here. So I was like, I'm just going to go to the elemental. Just
Yeah.
let's hit it.
Yeah. Heck yeah.
Okay. So I did 14 days of elemental and tested, did it, and all my levels were gone. And I was like, I'm healed.
Amazing.
I'm healed.
I'm sensing
Well,
a but wait.
but wait, how did you know? So 9 months later, it's back. And it's like, where you're curled up into a ball. Like I was just in tears with my husband. Like, what? Like, I'm doing everything. Like, I don't know if it's ever going to go away. So that's where I tested again using the food marble to see that it came back. It reoccurred, right? And so then I was on another journey, and I definitely included the nervous system, that and the restoration and the balance, which created a positive result, which is I had negative breath levels again. And this is where I'm maintaining it because I'm not symptomatic. So that's the beauty of, like you said, the balance and having an integrative approach. So anyway, we'll get to that. But yeah, if you can explain kind of the IMO, that would be awesome from your
Absolutely. And I also
perspective.
just want to say a testament to you. I love so much that you brought in the nervous system piece and the root cause and the integrative
Oh
piece,
yeah.
because that support and that work that you do, I truly believe is what really creates lasting results for people. And to
Okay.
to sit down with someone and have them be seen and talk and you listen. And I really think that patients often know intuitively what their root causes are, or at
Yeah.
least some of them. And if you just give them space to open up, and they will share. And if you can kind of really support them and also calm down their nervous system, I mean, what a beautiful way to support people. So thank you. Thank you for the work that you do and for sharing your story to help normalize this for sure. In terms of IMO, intestinal methanogen overgrowth, so while that SIBO, hydrogen SIBO piece and hydrogen sulfide are more associated with diarrhea, IMO is more associated with constipation. Yes. And it can be so tricky, especially we know that the higher your methane levels are, the more severe the constipation is. Do you remember how high your levels were when you got it, when you first
Yeah,
got
I think
tested?
I topped out at 48.
Okay, yeah, yeah. So a positive is technically 10 parts per million. So
Right.
that's just decently high. That is and so there's some different ways that we support IMO versus hydrogen SIBO and ISO. There's some overlapping themes. Elemental diet is pretty much the same for all three, which is exactly
Okay.
what you did.
Hmm.
When we're talking about antibiotics, we use different ones for methane. Reason being, one, the organism that makes methane, Methanobrevibacter smithii, is an archaea, not technically
Right.
a bacteria.
Yeah.
And so we kind of need some different things to treat that. And then the hydrogen organisms that then feed into that methane producer are actually different than
Hmm.
the hydrogen producers in regular hydrogen SIBO and hydrogen sulfide. But I digress. But you really need something that, when we're thinking about herbal antimicrobials or antibiotics, you need something that's going to address the hydrogen producers and something that's going to produce or affect the
Yeah.
methane producers.
Makes sense.
Yeah.
And so share with us the hydrogen sulfide. It's like the ugly stepchild, because I'm always like, because you can't really test for it. So I'm always just like, whatever, that guy over there. But tell us how you see hydrogen sulfide now.
Gosh, I feel like my mind has really been evolving quite a bit on this as well. I actually was very grateful to be part of a study led by Dr. Joshua Goldenberg, one of my colleagues, and we did this big international survey across practitioners treating what was then called hydrogen sulfide SIBO, based on kind of how it was diagnosed and how we're treating it, and then what results are. And so before we kind of had a breath test to test for hydrogen sulfide, a lot of practitioners were diagnosing either based on symptoms,
Okay.
what we thought kind of were those like pathognomonic typical symptoms, or what we called a flat line on a lactulose breath test. So if hydrogen never rose in that
Mm.
kind of third hour, or once it reached the large intestine like it's supposed to, the
Hmm.
theory was, okay, that's because these organisms that produce hydrogen sulfide are gobbling up these molecules of hydrogen to produce that gas. And we didn't have a way to test for the gas. So that was the theory. Now we actually do have a test for hydrogen sulfide, but we think of it kind of as this like Goldilocks gas. There's actually health benefits to having some hydrogen sulfide in the gut. But
Yep.
once we get to a kind of a level that the lab has a diagnostic level for hydrogen sulfide overgrowth, but it is kind of still being sussed out and maybe a little bit debated. But anyway, you're right. It is one that we're still learning a whole lot about. And really, the kind of nuanced thing that's being used to support these patients is bismuth, so the active ingredient
Okay.
Pepto-Bismol.
Pepto-Bismol. Okay.
Yeah. Who knew?
Like when it, but when it's easy and it works, like,
Yes. Yeah,
seriously,
yeah.
don't
Also,
question it.
disclaimer, this is not medical advice.
Yeah, yeah, yeah.
We're not your practitioners, but if this information is helpful, feel free to pass it along to your practitioner, and yeah, seek the care that you need.
That's right. This is tricky, right? It's not, it's just, yeah, it helps when you get help. Let's just say that.
Yeah.
Okay, so can we talk about, is it breath testing time?
Sure. Okay.
Thoughts,
What do we want to
thoughts.
talk? Just like overarching thoughts on breath testing?
Yeah, like, okay, I'll just start with Dr. Ruscio I follow, and obviously Dr. Seebecker and, Siobhan Sharna. So it's like your crew, right? Is Dr. Ruscio's like, maybe get a baseline, but like, don't go crazy with always testing, 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 because you can drive yourself crazy. Thoughts?
Okay, so I guess I've said this a lot already, so maybe it's my like theme of late, but I have actually quite changed my mind a bit recently on this one as well. So I think part of this is part of SIBO in general is just remaining open to new knowledge, new ways of thinking all the time. We have a ton of new research coming out, and I really still feel like we have so much to learn. So
Yeah.
I'm a big data person. I always have been, and I really loved that the introduction of the breath test provided a diagnosable and quantifiable cause of IBS. Who knew? Like that was a novel concept that then, we had treatment options for. And that is one of the best things that you can do for an IBS patient sometimes. It's just to make them feel seen and to
Yes.
know that it's not in your head.
Yes.
Breath testing, I personally in practice did a lot of lactulose breath testing. Kind of closer to the end of my practice, what I would typically do is I would get a baseline with, if somebody had never been tested before, especially, I would get a baseline with if somebody had constipation. Well, I would say just generally, I would do the 3 gas type breath tests for my baseline, just because I wanted to fully rule out hydrogen sulfide.
Yeah.
If somebody had constipation, hydrogen sulfide usually predominates over constipation. So sometimes I would just go straight to a test that only tested for hydrogen and methane. I was a big fan of repeat breath testing after treatment because I wanted to know, especially if somebody was still symptomatic. Were they still
Yeah.
symptomatic because they still had SIBO? Or were they still symptomatic because we treated it, it's gone, but there's something else that's really the root cause driving symptoms? And I thought that data was really important. I think perhaps beyond that, it can become a bit much for people. And I'm totally guilty of having people repeat test. I feel like I had patients who probably repeat tested like 15 to 20 times. And that was probably too much. So if you ever watch this, my heart goes out to you. And some people really liked the data, but I do think that maybe there's a time and a place. It can become expensive, labor intensive, all those things we already said. But ultimately, the goal here is that the person feels better. These conditions, as far as we know, aren't increasing risk of, your mortality, of, other poor health outcomes. It does definitely affect your quality of life, but your symptoms in that case are really what we're going after.
Yeah. And Dr. Davis's work, he would say the opposite. It's like if you don't get this treated, it leads to all these other very hardcore diagnosable
Yeah.
chronic issues.
Yeah.
So yeah. So what do you think?
I'll go a little bit against that. And I think that a lot of
Cool.
the data that we're seeing there is correlative. So we see correlation does not mean causation. And we're seeing this a lot in the microbiome research too, where we'll see, high rates of SIBO in endometriosis. Does that mean SIBO causes endometriosis? Or does it
Right.
mean that endometriosis can, affect having endometrial tissue in the bowel that can then, affect motility, and that can cause SIBO. Maybe it's a chicken or the egg situation.
Totally.
Same goes for, certain autoimmune conditions. I think it's really specific to the patient. We can see some nutrient deficiencies with SIBO as well. So that could be a case where it's like you really need to treat it in order to get improvement in that. So it's highly nuanced, but I don't think it's black and white.
Thank you. I'm like, where do we go? Okay, yeah, I'm before I like leave you, I'm like, okay, what do you think about COVID SIBO, GLP-1 and SIBO?
It's a can of worms. So I'll be more concise with this so that I can hopefully answer more questions. I would say definitely, I saw a lot more, maybe not more SIBO patients, but a lot more complexity with SIBO in the patients that had COVID.
Oh,
And
yeah.
so I don't know the exact clear mechanism of action for that. I don't know if it's fully been sussed out in the research, but that was my personal experience. GLP-1s, the way that they work is to delay gastric emptying and reduce small intestinal motility. So those, are reasons why maybe we could have higher prevalence of SIBO and IMO in those populations.
I will probably just echo the COVID. I had wild COVID 3 times while, having food
Oh.
poisoning, okay, that I never really experienced in my life during that time.
Yeah.
Estrogen dropping because I'm perimenopausal, right? Hypothyroid, SIBO, and then
Oh,
come to
take
find out the Hashi, because oh yeah, it was, and then the fungal overgrowth and the toxin over, like the burden, everything came to a head.
can only imagine what that was like to go through. I can empathize with it, but I can never fully understand it. That is terrible. And I feel like the silver lining is it's such a testament that now you've taken that terrible experience and turned it into how do I help other people navigate this? And that's a beautiful thing.
Yeah, when everything is blowing.
When life is falling apart, literally. Oh gosh.
Oh, yeah. So, okay. Dr. Pimentel in June 17th, so last month, he did this big talk with Siobhan, and it was like, okay. So he cited that Rifaximin works 44% of the time. And so I was like, I'm going to talk to Dr. Britta about if it works only 44% of the time, and if it's not covered, it can get real expensive real quick, especially if he's saying just take one a day
Yeah.
prophylactically. Like he's like, just use this thing.
Oh yeah.
Um,
For travel prevention of
yeah,
food poisoning.
for
Okay.
food poisoning. But even he even mentioned in this, like if you still are symptomatic, like he'll just say, like, just keep on this medication, right? So my thoughts was like, why are we going that route when we know that there's an elemental diet and bactericidins, and I don't know if I'm pronouncing this correctly. So bacterisins, like natural antibiotics that come
Herbal
from
antimicrobial. Huh? Yes.
from certain probiotics that act as antibiotics, natural antibiotics. Like me through treatment real quick. Because that's just like, I'm like, that's just not practical, but that's
Yeah.
that's where my mind goes. So talk to me.
This is such a great question, and I really liked what you said before too about you said where do we go from here, and that's something I said to one of my mentors the other day, Andrea Macbeth, and she said onward and upward with nuance, and I really appreciated
Mm.
that.
Yes,
Um,
we'll take that, Andrea. Thank you.
and so the nuance here is that in patients who had IBS-D and then also tested positive on the breath test, they just did a meta-analysis actually in 2026, so super recent. They had an eradication rate of about 59%. So
Okay,
it was better.
better.
So this is like you have that extra layer of having a breath test. And then on top of that, this was an older study on just 93 patients, but patients who normalized after rifaximin on the lactulose breath test had the highest response rate at 76.5. So
Okay.
there, that's a plug, I think, maybe for the lactulose breath test on kind of informing your decision making on what you're going to do, possibly.
Nice. Nice.
But yeah, I mean, I think that antibiotic is such a personalized decision, and I think, it can be very expensive, especially when we're talking about rifaximin. And we do have other treatment options as well. So, elemental diet, has some great data, and you've done it yourself. And to your question of like, why not just go straight there? I would say it is intense.
Oh yeah.
Yeah, yeah. And so I think having that educated conversation, with your provider and your healthcare practitioner of like, okay, what are the pros and cons of antibiotics, elemental diet, and herbal antimicrobials, and also remaining open that there is high possibility you might end up needing to kind of like mix and match in treatment rounds to get fully there.
Yeah, yeah, yeah.
Yeah.
When I Bacterisins going back to like so this specific the beast subtilis. I don't know if we can get into like this specific one, but it's like technically has, according to Dr. Davis, four Bacterisin capabilities in the sense that it's just a high Bacterisin probiotic.
Yeah.
So personally, I did super well with this particular product or probiotic.
Yeah.
Can you speak to why maybe that worked for me?
Yeah. And so, what I love here too is just I want to celebrate that because you were able to support yourself through food. And I just like what a beautiful thing. Food as medicine. So that's
Yay.
incredible. And I also think it kind of comes back to this concept of SIBO as dysbiosis, which is it's
Mm,
not necessarily an organism we just need to kill and eradicate completely. We want to support the ecosystem as a whole to kind of
mm.
achieve more of that balance. We're seeing that with a lot of organisms we previously thought were just like all bad all the time, like C. diff. Maybe there's some more nuance in there. So that would kind of be
Oh,
my hypothesis on why that really helped you and potentially can help a lot of other people too.
cool. Fiber. Why can't we just like if you had your client in front of you and they're just like, I know I need to eat fiber and then they eat too much and then they're not getting better. Like what would you say to them?
What would I say to them? So I think that there is absolutely a time and a place for fiber. And I do think that it's part of getting lasting results. The way that we implement it should be very mindful. And it's not a perfect science, but I would say kind of general rules for people that I found be very supportive is start low, go slow,
Okay.
and focus on fibers that we think will confer benefit to modulating the gut microbiome in a positive way. Generally, those are your prebiotic fibers. There's ones that are less fermentable than others. People have talked about PHGG or Acacia, or even thinking about things like polyphenols. So,
Mhm.
pomegranate skin, blueberries, green tea, things like that can kind of selectively modulate the gut microbiome. Maybe starting with some of those things, and then starting to branch out to ones that have a little bit more of a fermentable capacity, but can still really positively shift the gut microbiome. A great example would be beans. Big fan of beans. But like,
Absolutely.
don't eat a full serving of beans. If you haven't had beans in like 5 years and you're really struggling with SIBO, that will make you miserable. But sometimes what I would tell patients is think of yourself as a newborn baby. Maybe not newborn, but when you start to feed babies food and treat yourself like that. Like start with a couple of beans and then every few days start to double that amount and see how we can kind of improve this tolerance. You're literally nourishing the bacteria that's needed to break those things down, but you have to do it slowly.
That's so good. And that's a perfect segue into what are you doing now? Because you threw out the word pomegranate and I'm like, so talk to us about is it pronounce the name of your company again?
Yes, Dhara,
Dara.
Dara. Yes, Dhara. It's a Sanskrit word that means earth and flow. So kind of this concept of everything coming from the earth, working with the body instead of against it, and then everything going back to the earth. So we're big on sustainability and using natural plant medicines. Yay! We
Get it, girl.
have three different products currently. One is an herbal antimicrobial for that we're using to try and support that hydrogen, SIBO, and IMO piece. And then maybe the other relevant thing here would be our prebiotic fiber. So it's a gentle, low fermentable prebiotic fiber, exactly kind of for that circumstance we talked about where somebody is recovering from SIBO or, mast cell activation syndrome, histamine intolerance, mold, fungal, people who are really sensitive, like I and you have been at periods of time, but we need to grow our microbiome. So how do we do that intentionally? And that is this product was a collaboration with two other SIBO practitioners.
Gosh, I'm thinking about a client like straight away that,
Oh,
yeah, has gotten hit by all, and so the low fermentable, the easy, the gentle, like that's exactly what, yeah, the body needs. So thank you so much for that. I want to leave you with like any parting words that you want to offer before you got to get going. What do you want to share? What's more of your mission? Like whatever you want to do.
I feel like maybe my final words are be kind to yourself, stay
Mm.
curious. I think, people going through this deserve a lot of compassion. It can be incredibly challenging, not only physically, but emotionally. And as much as we can support each other on that journey, it means a lot. So thank you for doing what you're doing and for creating this community of people who are curious and want to learn more and want to support each other. I think that's truly, truly the best thing that we can do.
And be gentle. Well, you're walking the talk. I hope to see you at our practitioner, one of my practitioners' spot, the Sela Center, and hopefully you get to teach us practitioners more about what Dhara
You got it.
is doing. So love that, and I am going to leave it at that, my friend, Dr. Britta. Thank you so very much.
Thank you so much, Taylor. It's your day. And yes, let's chat about our next collaboration of things that we can do. I'm looking forward to it.
Let's do it.
All right. Take care.